Nurses and doctors, lab techs and hospital staff are hard at work to keep us safe. They're showing up for us, and we need to do the same for them. Over the weekend, we received new shipments of essential personal protective equipment, including 4 planes worth of N95 masks. As we speak, workers are unpacking and validating these supplies so we can start shipping them to the provinces and territories as quickly as possible. These new N95 masks are in addition to the more than 820,000 that went to provinces last week. All told, this means that we have 1.1 million N95s ready to be shipped to the provinces and territories, with more to come. We have also received millions of pairs of gloves, and we'll be getting new protective gowns delivered from domestic suppliers starting next Monday. En fin de semaine, on a reçu 4 envois d'équipements de protection individuelle essentiels.
Individual protection equipment shipping, including N95 masks. We got a shipment for Quebec. Those new N95 masks are added to the 120 masks, 120,000 masks we got last week. And together, we're about to send 1.1 N95 masks to provinces and territories in the next few days. We've also received millions of gloves, and we will get new gowns for starting next week. For tests, we are making some important progress. I'm thinking about the Spartan Bioscience business based in Ottawa. We'll give tens of thousands of kits every month. As Dr. Tan said yesterday, over 430,000 tests were done in Canada. We will continue to increase our capacity and study new technologies in order to simplify tests across the country.
In the last few days, we've also made progress on testing. Right now, we're moving forward on a range of rapid testing kits, both from here in Canada and internationally. This includes Ottawa-based Spartan Bioscience, who will soon be supplying tens of thousands of kits per month and potentially more as production increases. As Dr. Tam said yesterday, more than 430,000 Canadians have now been tested for COVID-19. Our experts and health professionals are working hard to increase our capacity to keep ramping up tests across the country. Demand for these supplies is going up, and we're going to make sure Canada can keep up.
COVID-19 has transformed the daily life of every Canadian, but it's clear that those who are living in the Arctic areas do not have the same issues than those living in cities. For instance, I know that many are worried to see the shelves of their grocery stores empty. Others are worried about if they're the type of healthcare services have enough space and resources to fight this virus if it comes to their community. I'm assuring you that we do everything we can to make sure this doesn't happen. Today, I'm announcing that the government is investing close to $130 million to help northern communities to fight against COVID-19. From this amount, $72.6 million will be given to Yukon, to the Northwest Territories, and to Nunavut for their healthcare system and to fight against COVID-19. We also give the amounts to Nutrition North Canada for essential goods and services are affordable and to help families to stay healthy. And for food and equipment, medical equipment gets to you, we're working with the air transport companies who are sending essential goods to the northern communities. Finally, I know that many companies in the north are particularly touched by this crisis. We are offering help to the business owners, which expenses are not already covered by the other measures that we've put in place.
Today, I can announce that we're investing almost $130 million to support northern communities in dealing with COVID-19. If you live in the north, chances are you're worried about whether your local health center has the resources to fight COVID-19 and to cope with cases that might come up. So we're providing $72.6 million to the Yukon, the Northwest Territories, and Nunavut, specifically for healthcare and community preparedness. We're also investing more money to Nutrition North Canada. This will make it easier to afford the food and basics that keep you and your family healthy. And to ensure that things like groceries and medical equipment can continue to get to you, we're providing funding for Northern air carriers to transport these supplies. These are tough times, but we're going to help you through them, to set your community up to come back strong when things get better, because they will. We have to think about small businesses, too. I know entrepreneurs in the North have been hit especially hard by this crisis. If you own a business and your costs aren't already covered by other measures we've put in place, we're giving CanNor more funding to help. No matter where you live, in a small community or a big city, we're here for you. This weekend, we brought Parliament back to pass the largest economic policy since the Second World War. With the Canadian Emergency Wage Subsidy, we will protect jobs by helping businesses keep their employees on the payroll. We'll be rolling this measure out as quickly as possible. And now, as many people as we've already helped, and we're talking about millions of Canadians, we know there is more to do. You might not currently qualify for the Canada Emergency Response Benefit, but you still might need a hand. If you're a student or an essential worker, for example, this week we'll be talking about how to reach you, while also supporting sectors that have been especially hard hit. At the same time, we're working to enhance the Canada Emergency Business Account, as well as new supports on commercial rent for businesses that are hardest hit. I'll have more to say about all this soon. If you've come back to Canada from abroad, as of today, we are strengthening measures. Now, if asymptomatic travelers cannot explain a credible quarantine plan, they will be required to quarantine in a hotel. This will come into effect at midnight tonight. We are also announcing $20 million for the Canadian Food Inspection Agency to strengthen food inspections and keep our food supply safe. This will mean we can build capacity for more overtime and extra shifts for inspectors to fill demand. It also means we can invest in things like hiring and training to get more people on board. On vit des moments difficiles.
We're experiencing tough times, and throughout the country, I know that many people are worried, not only for their future or their health, but for that of their parents and grandparents. Elderlies are particularly vulnerable against COVID-19, and it means that we shouldn't go and visit them in the elderly homes and the long-term care institutions. To help protect them, we have published new directives for these types of institutions. We've established rules on restrictions, on the control of the staff, and procedures to follow in case of an infection. At the same time, we continue to work with the provinces and territories in order to make it so that they have all they need to keep people healthy.
I want to take a moment to speak directly to everyone who's lost a loved one. If you're grieving, know that you're not alone. We are here for you, even through this incredibly tough time. And you remind us why it's so important to do everything we can to keep one another safe. We all need to do our part. We can't let up now. So to everyone, stay at home. And no matter what, stay 2 meters apart if you do have to go out. When it gets hard, let's remember that we're all in this together. Merci beaucoup. Et maintenant, prendre les questions.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Kate Bongaro, Bloomberg. Line open.
Hello, Mr. Prime Minister. I'm wondering, what is your government's concrete plan to reopen the economy? For example, a rolling, staggered, or an all-at-once approach? And can you give us more information about these plans and your discussions with the provinces on reopening the economy?
I know that everyone is very interested to know when things are going to get back to normal, when they'll be able to go back to work, when we'll be able to leave this isolation at home, when kids will be able to go back to schools. The reality is it is going to be weeks still. We recognize that it is going to be important to get our economy going and that we will have to do it in phases. We will have to remain vigilant until such a point as a vaccine against COVID-19 is found. We are having ongoing discussions with the provinces at this point. We recognize that different regions of the country are at different places along the evolution of their COVID-19 curve. We're going to make sure that we try to stay coordinated as best as possible, but those discussions are ongoing about how we're going to reopen the economy. It's just that it's going to be a while still.
And you had just mentioned sectors.
Sorry, I just let me answer in French.
Of course, people want to know, when will we be able to get back to normal life? When will they be able to go back to work? When will they be returning to school? The reality is that we must stay extremely vigilant, and in the current situation, for many weeks still. But at one point, we will be able to, I hope, start to release a few measures. And we will do this in coordination with provinces. We acknowledge also that different regions of our country are facing different impacts and are at different places on their journey of the curb's evolution of COVID-19. And we'll be vigilant until we have a vaccine. And those are conversations that we will continue to have, but it's not for now.
Follow up, Kate.
Okay, perfect. So, and you had just mentioned about sectors who have been especially hard hit by COVID-19 and that we should be expecting news on help for them soon. And I'm wondering specifically, when is the oil industry bailout coming?
First of all, we recognize that the most important thing from the very beginning was to get help out to Canadians right across the country, regardless of the sectors they're in, regardless of their situation or their location. That's why we put forward two extremely strong measures that help all workers across the country: the Canada Emergency Response Benefit for people who've lost a paycheck, and the emergency wage subsidy so that people can keep their jobs and be ready to come back to work when the economy comes back. As I've said a number of times, we will and we are looking at more specific sector-related relief and supports for those sectors that are hardest hit, whether it's the tourism sector, the airline sector, or the oil and gas industry or others. And we will have more to say on that shortly.
Thank you. Next question.
Thank you. Merci. La prochaine question, Raymond Fillon, TVA, à vous.
Bonjour, Monsieur le Premier ministre.
Regarding the elder care center, we know it's a provincial jurisdiction, but on top of any directive that you're giving, what can your government do regarding those centers that can help? For instance, in the precise case of the Heron House in Montreal, this is an horror story, really. We're sending all our sympathy and our condolences to the families of those affected, not only there, but across the country by the high rate of mortality in our elderly care center. And that's why we underline up to what point it's important that people must follow the directives and stay at home and keep distance to slow down the propagation of COVID-19. As you're saying, the elderly centers and those care centers are under provincial jurisdiction. We've emitted directions, and we continue to work with provinces in order to do what we can do to help them and to keep our elderly people healthy and safe. And we acknowledge that they are the most vulnerable to COVID-19, and that's why we must all, at every level of government and every Canadian, do everything we can to protect them.
We recognize the terrible and tragic stories that have come out of seniors' residences and long-term care facilities across this country. And our hearts go out to families who've lost loved ones in some terrible ways. We know we need to do more, and that is why we are highlighting how important it is, not just for ourselves, but for our loved ones, for our healthcare workers, for our seniors, that we continue to follow directions, that we stay home as much as possible, that we keep 2 meters apart wherever we can, and that we continue to wash our hands regularly. We need to make sure that our seniors who are most vulnerable to this are protected. As mentioned, seniors' residences are provincially mandated, but the federal government has put forward guidelines for across the country on making sure that our seniors are protected.
Suivi.
Un des gros problèmes dans ces centres, c'est le manque criant d'employés, de personnel. Est-ce que les médecins, les infirmiers, infirmières des forces canadiennes pourraient être mis à contribution? Avez-vous à faire quelque chose en ce sens-là aux provinces?
Nous reconnaissons qu'il y a des mesures prises par les provinces.
We acknowledge that some measures taken by the province, for instance, to force people to work only in one center and not in many different centers, will help to protect people, but will create needs to hire new people to work in those centers and to help our elderly. We are currently working with provinces in order to ensure that we have the capacity to have the necessary people to help our elderly.
We recognize that some of the measures taken in place to protect our seniors in our long-term care facilities, such as asking people to only work in one center instead of a few of them, will mean a need to hire more people to support our seniors and to work in those centers. And we're going to continue to work with provinces on ways to ensure that people can be found to do this important work.
Thank you. Prochaine question, modérateur.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais revenir à votre
I would like to go back to your time at your secondary home at Lake Harrington. For many weeks now, authorities are saying don't go to your cottage. There on the Ottawa River, there's even some control by the police to make sure that people don't go from Ottawa to Gatineau. But why was it okay for you to do this? I announced last week that after 3 weeks of working here, my family living permanently in Lake Harrington, that I would go and spend Easter with them. And that's what I did. We continue to follow all the directives from the authorities.
As I mentioned last week in my presentation, after 3 weeks of my family living up at Harrington and me working here, I went to join them for Easter. We continue to follow all the instructions from public health authorities.
Merci. Question de suivi, Hélène.
Mais oui, avez-vous eu une indication comme quoi?
Did you get any indication that it was okay? Because that's a question people are asking, and they're writing to us asking, why is it for you okay to go to your cottage to see your family on the weekend? My family lives there. I've been living there for the last 3 weeks. That's where my wife and kids are. And as I announced last week, I went to spend Easter with them.
On va passer à la dernière question au téléphone. Modérateur.
Thank you. Merci. Next question, Alex Ballingal, Toronto Star. Line is open.
Morning, Prime Minister. You mentioned in your introduction that people traveling to Canada will need a credible quarantine plan. Can you expand on what the government's definition of a credible plan will be? Who will assess that? And where will that be applied at the land border as well as at airports?
The order that goes in tonight is a strengthening of the Quarantine Act orders to give authorities the ability, upon evaluation of the person entering Canada's plan to self-quarantine, if it is inadequate, they will be required to quarantine in a hotel. Examples of things that could be inadequate, for example, if their plan is to go stay in a place where there are many elderly family members at risk of COVID-19, or whether they don't have a set destination if they've been outside of the country for many years. We now have the authority to require them to self-isolate for 2 weeks in a quarantine location like a hotel.
On follow-up?
Okay. Yeah, I noticed in the daily updates from public health, there's been incomplete information sort of stubbornly over a period of time, with case report forms on only 62% of our cases, hospitalization data for less than half. Why is this such an incomplete picture? And are you concerned that having an incomplete picture will affect or make it more difficult to allocate resources across the country?
I want to once again thank the provinces for being tremendously active on improving the quality of the data that they send us in Ottawa. There were significant gaps in the beginning, but I can highlight that almost all provinces have done a much better job in sharing their data with Canadians in their provinces, but also with the federal government, that is allowing us to have a much more complete picture. We continue to improve on data collection and collation every single day, but that is something that, as you highlight, is a really important way to ensure that we're doing the right things at the right point to keep Canadians safe.
Prime Minister Michael Couture with Global National. I wanted to ask you, Alberta's energy minister has said that she's expecting a federal relief package for Canada's oil and gas sector between $20 and $30 billion, and she's expecting it later this week. Can you confirm those details first, and can you say if the federal government will be taking equity stakes in Canadian firms?
When we have issues to announce on sectoral supports, we will be making those announcements, Mike.
So then, as a follow-up, some workers in the oil patch worry that key Canadian companies will be vulnerable to foreign takeovers or will decide to relocate head offices to other jurisdictions. Should your government forbid foreign takeovers in the energy sector or relocations for at least this period of time?
We are very concerned about the state of a number of industries across this country, including the oil and gas industry, and that's why we have worked hard on making sure that we're giving the right supports for the industry, and particularly for workers across the country. Our focus has always been on ensuring that good Canadian jobs remain. We know that Canadians and families are suffering, and that's why we need to support them.
We recognize how it's important to protect our industries in order to get back in force once this crisis is over. But it's always through the support to workers and families that are affected by COVID-19.
Hello, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. You said that you're going to have more news about essential workers and the CERB in the coming week, but employees at long-term care facilities are already leaving their jobs. You brought Parliament back and you passed the wage subsidy this weekend, but there was no specific help included for the long-term care industry. What specifically is your government going to do now to keep long-term care facilities properly staffed so that the new guidelines your government implemented this weekend can be followed?
We are in conversation with the provinces right now on moving forward on a model of increasing support for long-term care workers and other workers in essential industries, like Quebec has done, to ensure that people are motivated and encouraged financially, as well as because it's something that they believe in deeply, to continue caring for our most vulnerable.
We recognize that Quebec, for instance, have taken some concrete measures to encourage and reward all those working in essential jobs, like in our elderly home care centers, that are so important at this point. And we are discussing with the provinces in order to look at this and stretch this on a national level.
Canada's intelligence network was not prepared for the pandemic, and that instead of being able to rely on our own Canadian intelligence, we were dependent on our American allies as well as the Five Eyes network. When specifically and exactly did Canadian intelligence tell you about the possibility of a pandemic, and when did you hear that information from our allies?
We had meetings of the incident response group as of late January to talk about the COVID-19 potential threat. We were well coordinated with our Five Eyes allies and other intelligence services around the world, and being aware of this potential challenge on the horizon, and we're dealing with it as of the end of January.
We had meetings in terms of security and intelligence at the end of January, where we underlined the importance and the preoccupation we all had regarding coronavirus. And that's something we continue to follow up, starting that point, along with our allies of the Five Eyes and the other allies across the world. You spoke earlier about a gradual relaunch of the economy. You called it phases in English. What would it look like in Canada? A bi-phase relaunch of the economy for people in their daily lives, but also at the American border. I understand that people want to know when we will get back to suspended economic activities, and I must put the emphasis, the accent on the fact that we must stay in the current phase for a while. We haven't moved on the other side of the curve of this first wave of COVID-19. We must hold on until science and experts tell us that we can release a few measures. Now, there will be some industries, some sectors of the industry where people will be able to get back to work more safely, and that's what we will discuss with the provinces. We will discuss in the weeks coming. Now, regarding the Americans, we continue to be in discussion with our neighbors on a coordinated approach, but it's sure that the traveling restriction will remain for many weeks.
We recognize that people are eager to know when we'll get into the next phase and be able to loosen some of the restrictions on work, on school. We will be looking at that very carefully with the provinces in different ways across the country to make sure that where we start work up again in the weeks where we're allowed to do that, because right now, we are still very much in this phase and will need to remain in this phase for a good while still. But as we start to open up, we will be strategic and vigilant about what we are able to do in a very gradual way. In regards to the American border, we recognize that travel restrictions are going to remain extremely important in terms of containing the spread of COVID-19 in Canada, and we're going to continue to work with the Americans and people around the world to ensure that we continue with these restrictions.
Regarding the long-term care centers, you said you're in a conversation with provinces how to help them. What are provinces asking? Money, staff, Canadian Armed Force staff intervention, medical staff intervention? But what concretely can you do to help them? Not only directives, but concretely. Our conversations regarding the home care centers are because the different regions have extremely different situations. Some people are really interested by the Quebec model that wants to give extra salary to those who are working in those centers. And some provinces are interested in the federal government could participate in sending money to help those. And there's some other proposal that other provinces are looking at. And we recognize how it's important to be there for the elderlies. And as I know, there hasn't been any request for Canadian Army of any kind.
We've been looking at different ways of ensuring that our long-term care facilities and our seniors' residences have the support that they actually need, have the workforce that they need to take care of our seniors. There are a number of provinces looking at the model put forward by Quebec that involves a salary top-up for people working in these essential jobs. We are willing to participate in that, in sending money to the provinces to help in those, and we're having discussions with the provinces about what that is. But there are very different needs and situations right across the country, and we're continuing to work with different provinces on their different priorities.
Prime Minister Tom Perry with the CBC News. Premier Jason Kenney says that federal bureaucracy is standing in the way of approving tests and drugs to use against COVID-19. He's directed his officials to consider using medications that have been approved by Europe or the U.S. Health officials. Health Canada is the regulator of these approvals here in Canada, so what would the consequence of a province attempting to do this be, given it doesn't have that jurisdiction?
We are in an unprecedented crisis, and that creates a significant level of anxiety. So I understand that people can get anxious and impatient about things, but as a government, we are going to remain grounded in science. We are going to remain grounded in our experts who are doing an excellent job in ensuring that Canadians are kept safe and healthy.
I acknowledge that in this unprecedented situation, people can become anxious and impatient. But we will stay anchored in the recommendations that scientists are giving us, that the public health experts are giving us, regarding how we need to keep Canadians healthy and safe.
Premier Kenney also spoke yesterday about Dr. Theresa Tam. And he said he believes she's qualified to be Canada's Chief Public Health Officer, but he also said that in January she was repeating talking points out of the People's Republic of China about there being no evidence of human-to-human transmission. What's your response to that? And do you think comments like this run the risk of undermining the credibility of Canada's public health officials?
I think Canadians have demonstrated that they have a tremendous level of trust and confidence in our public health officials and in our medical system. And we are going to continue to work with top medical officials like Dr. Theresa Tam to make sure that we're doing everything we need to do and have done every step of the way to keep Canadians safe.
Canadians are happy to have every right to trust in our experts and the medical experts and our public health officials. They are there to protect us, and we will continue to work with all the public health officials and experts to ensure the safety and security and health of every Canadian, including the amazing Dr. Tam.
Merci tout le monde.